Have you ever woken up feeling a little off, a subtle whisper from your body that something isn't quite right? Maybe it's a persistent tiredness that lingers no matter how much you sleep, or a nagging ache that sets in without any clear reason. As we journey through our wonderful golden years, our bodies, like well-loved companions, communicate with us in unique ways. We become experts at recognizing their familiar rhythms, their usual aches and pains that come and go with the day. But sometimes, there's a new note in that symphony of sensations, a persistent discord that signals a need for closer attention. We all deeply cherish the independence and the simple joys that each day brings. We look forward to spending quality time with our families and friends, pursuing our beloved hobbies, and embracing life to its fullest. And at the heart of all this is our health and well-being. Being proactive about our health is not just about living longer. It's about living better, with more energy and vitality. That's why today, we're embarking on a crucial conversation, one that focuses on 5 specific signs that you might notice when you wake up that should encourage you to seek medical advice promptly. Now, I understand that the word cancer can evoke feelings of unease, but knowledge is power, and early detection is our strongest ally in achieving positive health outcomes and ensuring we can continue to enjoy the richness of life. This isn't about dwelling in fear, it's about empowering ourselves with information, cultivating awareness, and taking proactive steps to safeguard our health. Imagine your body as a magnificent, time-tested home, filled with cherished memories and a lifetime of experiences. Just like any home that has stood the test of time, it might occasionally develop a few gentle creaks or require some extra tender care. We become adept at recognizing the familiar sounds and sensations, the usual sighs and groans. But now and then, there might be a new sound, a different kind of tremor, that suggests a deeper need for inspection. That's precisely what we're going to focus on today, those distinct and unusual signals that warrant a professional opinion, a closer look from someone who can provide expert guidance. Before we delve into these 5 vital morning signs, I want to emphasize something very important. I am not a medical professional. The information shared in this video is intended for educational purposes only and should not be interpreted as medical advice. It is not a substitute for the professional guidance and diagnosis provided by your own doctor. If you are experiencing any health concerns or noticing any unusual changes in your body, please take that proactive step and schedule an appointment with your physician. They are the most qualified individuals to assess your specific situation, provide an accurate diagnosis, and recommend the most appropriate course of action. So, let's begin. Let's explore those 5 key morning indicators that should encourage you to prioritize a visit to your doctor without delay. The very first sign we're going to discuss is the presence of persistent and unexplained fatigue. Now, it's a common human experience to feel tired from time to time. Perhaps we had a restless night's sleep, or we've been particularly active throughout the day. This kind of tiredness is a natural response to our activities and usually dissipates with adequate rest. However, the fatigue we're focusing on here is fundamentally different. It's a profound, overwhelming sense of exhaustion that doesn't seem to lift, no matter how much sleep you get. It's a persistent shadow that hangs over you day after day, week after week. It's not just a passing feeling of low energy. It's a deep-seated depletion that significantly interferes with your ability to carry out your normal daily activities. Take a moment to reflect. Do you find yourself struggling to rise from bed in the morning, even after what should have been a full and restorative night's sleep? Do you experience a pervasive feeling of being drained and weak throughout the entire day, making it increasingly difficult to engage in the activities you typically enjoy? Perhaps your usual leisurely morning walk now feels like climbing a steep mountain, or even simple household tasks leave you feeling utterly and completely depleted of energy. This type of persistent fatigue, especially when it emerges suddenly and without any identifiable cause, is a signal from your body that warrants careful attention. Persistent fatigue can sometimes be an early indicator of underlying health issues, including certain types of cancer. Cancer cells are rapidly growing and dividing, and they can compete with healthy cells for essential nutrients, leading to a general feeling of tiredness and weakness. Additionally, when cancer is present, the body's immune system kicks into high gear to fight it, and this constant state of heightened immune activity can also contribute significantly to feelings of fatigue and exhaustion. Of course, it's important to remember that fatigue can have many other causes, such as anemia, a deficiency of red blood cells, various infections, thyroid disorders, or even simply the accumulated stress of daily life. That's precisely why it's so crucial to consult with your doctor if you are experiencing this kind of persistent, unexplained exhaustion. They can conduct thorough examinations and order appropriate tests to pinpoint the underlying cause of your fatigue and provide you with the necessary and tailored care. Please don't simply dismiss it as just getting older. While our energy levels may naturally evolve over time, this kind of debilitating fatigue is not a typical or expected part of the aging process and deserves prompt medical evaluation. The second crucial warning sign we need to discuss is the presence of any unexplained and persistent pain. It's a common experience to have aches and pains from time to time. Perhaps you slept in an awkward position, or you engaged in a bit more physical activity than usual the day before. These types of pains are generally temporary, have a discernible cause, and tend to subside relatively quickly. However, what we need to be particularly mindful of is pain that is persistent, doesn't have a clear explanation, and doesn't respond to typical home remedies such as rest, heat or cold therapy, or over-the-counter pain relievers. This could manifest as a localized pain in a specific area of your body, or it could be a more generalized feeling of discomfort that simply refuses to go away. Consider waking up and consistently feeling a dull, nagging ache in your back that doesn't seem related to any particular activity or strain. Or perhaps you experience a sharp, stabbing pain in your side that comes and goes unpredictably but keeps recurring. Maybe it's a persistent headache that is unlike your usual headaches and doesn't respond to your standard remedies. Any pain that is new, persistent, lasting for several weeks or longer, and doesn't have an obvious trigger should be evaluated by your doctor. In some instances, cancer can cause pain as a tumor grows and begins to press on nearby nerves, organs, or bones. For example, persistent bone pain, especially if it intensifies at night, could potentially be a sign of bone cancer or cancer that has metastasized, spread, to the bones. Unexplained abdominal pain could be a symptom of various cancers within the digestive system. Similarly, persistent headaches that are different in character or severity from your usual headaches could be a cause for medical concern. Now, it's absolutely vital to remember that the vast majority of aches and pains are not indicative of cancer. Conditions like arthritis, nerve compression, injuries, and a multitude of other non-cancerous issues can cause persistent pain. However, because pain can sometimes be a symptom of cancer, it's always prudent to err on the side of caution and seek professional medical advice. Please refrain from attempting to self-diagnose or dismissing persistent pain as simply a consequence of aging. Your doctor is equipped to conduct a thorough physical examination, review your medical history, and order any necessary diagnostic tests to accurately determine the underlying cause of your pain and provide you with the appropriate and timely treatment. If it turns out to be something less serious, that's wonderful news and will undoubtedly provide you with peace of mind. But if it does happen to be something that requires medical attention, early detection and intervention can significantly improve the chances of a positive outcome. The third important warning sign that warrants immediate medical attention is any unexplained changes in your bowel or bladder habits. Our bathroom routines are often private matters that we may not readily discuss, but they can actually provide valuable insights into our overall health. It's important to be aware of any significant changes that are persistent and don't seem to have a simple explanation, such as a recent dietary change. For example, have you noticed a persistent shift in the frequency of your bowel movements? Are you suddenly going to the bathroom much more often or significantly less often than what is normal for you? Have you experienced a noticeable change in the consistency of your stool, such as persistent diarrhea or constipation that lasts for more than a few days or weeks? Have you observed any blood in your stool, even a small amount? These are all changes that should be brought to the attention of your doctor. Similarly, it's crucial to pay attention to any alterations in your bladder habits. Are you experiencing a sudden and frequent urge to urinate, particularly during the night? Are you having difficulty initiating or stopping the flow of urine? Have you noticed any blood in your urine, even if it's just a tinge? Are you experiencing pain or burning sensation during urination that doesn't seem to be related to a typical urinary tract infection? These are also important signs that you should discuss with your doctor. Cancers affecting the colon, rectum, bladder, prostate gland, in men, and ovaries, in women, can sometimes manifest as changes in bowel or bladder habits. For instance, a tumor growing in the colon can obstruct the passage of stool, leading to alterations in bowel frequency, consistency, or even bleeding. Cancers of the bladder or kidneys can cause blood to appear in the urine or changes in the frequency of urination. Prostate cancer can put pressure on the urethra, leading to difficulties with urination. While ovarian cancer might not directly cause immediate changes in bowel habits, it can cause persistent bloating and abdominal discomfort, which might indirectly affect them. Again, it's crucial to emphasize that many other conditions besides cancer can cause changes in bowel and bladder habits, such as infections, irritable bowel syndrome, IBS, dietary modifications, or certain medications. However, Because these changes can sometimes be a manifestation of a more serious underlying condition, including cancer, it's essential to have them evaluated by your doctor, especially if they are persistent, unexplained, and accompanied by other concerning symptoms. Please don't feel any embarrassment in discussing these matters openly and honestly with your doctor. They are medical professionals dedicated to your well-being and are there to help you. Early detection of cancers in these areas can significantly improve the likelihood of successful treatment and a positive prognosis. The fourth warning sign that warrants prompt medical evaluation is the appearance of any unexplained lumps or swelling on your body. As we go about our daily routines, we naturally become familiar with the contours and textures of our own bodies and are likely to notice when something feels different or new. Be particularly attentive to any new lumps, bumps, or areas of swelling that you discover while getting dressed in the morning or throughout the day. These could potentially appear anywhere on your body, such as in the breast area, testicles, in men, neck, armpit, groin, or even just underneath the skin in various locations. If you discover a new lump or area of swelling, try not to panic, but definitely don't ignore it. Take a moment to note when you first became aware of it and whether it has undergone any changes in size or texture since then. Is it painful to the touch or relatively painless? Does it feel firm and solid or soft and movable? These details, however minor they may seem, can provide valuable information for your doctor. Lumps and swelling can arise from a multitude of causes, the vast majority of which are benign, non-cancerous. These can include cysts, fluid-filled sacs, lipomas, fatty tissue lumps, or swollen lymph nodes, which often occur in response to an infection elsewhere in the body. However, it's important to be aware that some lumps can indeed be cancerous. For example, the discovery of a new lump in the breast is a well-known potential warning sign of breast cancer. Similarly, lumps in the testicles can be an indicator of testicular cancer. Persistent swelling of the lymph nodes in areas like the neck, armpit, or groin could potentially be a sign of lymphoma, cancer of the lymphatic system, or leukemia, cancer of the blood and bone marrow. Therefore, it's absolutely essential to have any new and unexplained lump or area of swelling examined by your doctor as soon as possible. They will be able to carefully feel the lump, ask you detailed questions about when you noticed it and any changes you've observed, and determine whether further investigation is necessary. This might involve imaging tests such as an ultrasound, mammogram, for breast lumps, CT scan, or MRI, or it could involve a biopsy, a procedure where a small sample of the tissue from the lump is taken and examined under a microscope by a pathologist. Early detection of cancerous lumps significantly increases the chances of successful treatment and a more favorable outcome. So, if you notice something new and unusual on your body, please don't hesitate to schedule an appointment with your doctor without delay. It's always better to have it checked out and receive reassurance that it's nothing serious than to ignore a potentially significant issue that could have serious consequences if left untreated. The fifth and final warning sign that we're going to discuss in detail today is the occurrence of unexplained weight loss. Now, it's perfectly normal for our weight to fluctuate slightly over time due to various factors such as changes in diet, activity levels, or even stress. However, what we're talking about here is a significant and unintentional loss of weight, typically defined as losing 10 pounds or more without actively trying to do so, and without making any deliberate changes to your diet or exercise habits. If you suddenly find that your clothes are fitting much looser than they used to, or if the numbers on your bathroom scale are consistently dropping unexpectedly, this is a sign that you should take seriously and discuss with your doctor. Unexplained weight loss can be an indication that something is going on within your body that is causing you to lose weight without any conscious effort on your part. This can occur due to a variety of underlying medical conditions, including certain hormonal imbalances like hyperthyroidism, an overactive thyroid gland, various types of infections, or digestive disorders that interfere with nutrient absorption. However, it's also important to be aware that unexplained and significant weight loss can be a symptom of some types of cancer. Cancer cells are rapidly growing and metabolically active, and they can consume a significant amount of the body's energy reserves, which can ultimately lead to weight loss. Additionally, some cancers can affect your appetite, making you feel less hungry, or they can interfere with your body's ability to properly digest and absorb nutrients from the food you eat, both of which can contribute to unintentional weight loss. Cancers of the pancreas, stomach, esophagus, and lungs are sometimes associated with unexplained and significant weight loss as an early or prominent symptom. If you have noticed a substantial drop in your weight without making any conscious effort to lose weight, please make an appointment to see your doctor as soon as possible. They will ask you detailed questions about your medical history, your current diet, any changes in your appetite, and any other symptoms you might be experiencing. They may also order a variety of blood tests, imaging studies, or other investigations to try to determine the underlying cause of your weight loss. Just like the other signs we have discussed today, significant and unexplained weight loss is not considered a normal part of the aging process and should always be thoroughly evaluated by a qualified medical professional to determine the underlying cause and ensure you receive appropriate care. Early detection of any underlying cause, including cancer, can often lead to a wider range of more effective treatment options and improve your overall prognosis. So, there you have it. 5 important warning signs that should prompt you to schedule an immediate appointment with your doctor. The presence of persistent and unexplained fatigue that doesn't improve with rest, the experience of unexplained and persistent pain that doesn't have an obvious cause, any noticeable and unexplained changes in your normal bowel or bladder habits, the discovery of any new and unexplained lumps or areas of swelling on your body, and significant and unintentional weight loss without any changes to your diet or exercise routine. Now, I want to emphasize once more that experiencing one or even several of these signs does not definitively mean that you have cancer. These symptoms can be associated with a wide range of other medical conditions that are far less serious. However, it is absolutely crucial not to ignore these potential warning signals or to simply dismiss them as just another part of the aging process. Your body is a remarkable instrument that is constantly communicating with you, and it's essential to pay close attention to its subtle cues and respond appropriately when something feels out of the ordinary. Think of your doctor as your trusted partner in maintaining your health and well-being. They are there to provide you with expert guidance, help you understand what's happening within your body, and ensure that you receive the best possible medical care. By being informed about these potential warning signs and proactively seeking medical attention when you notice them, you're taking an active and empowered role in safeguarding your health and ensuring a brighter and healthier future for yourself. Remember, early detection is often the most critical factor in the successful treatment of cancer. Finding cancer in its early stages, when it is often smaller and hasn't spread, frequently means that there are more treatment options available and a significantly higher likelihood of a positive outcome and long-term survival. Please don't let fear, anxiety, or hesitation prevent you from seeking the medical attention you need and deserve. It is always far better to get something checked out promptly and receive reassurance that it is nothing serious than to delay seeking help and potentially allow a health issue to worsen over time. Your health is undoubtedly your most precious asset. It is the foundation upon which you build your life, allowing you to cherish time with your loved ones, pursue your passions and interests, and experience the richness and joy that life has to offer. Taking care of your health is an act of profound self-love and a precious gift to those who care deeply about you. So, please, be vigilant and attentive to your body. Pay close attention to any changes you notice in how you feel or any physical changes you observe. Don't hesitate to reach out to your doctor if you have any concerns, no matter how small they might seem. They are there to support you, provide expert guidance, and help you navigate your health journey with confidence and peace of mind. We all share the desire to continue living vibrant, healthy, and fulfilling lives for many wonderful years to come. By staying informed, cultivating awareness, and being proactive about our health, we can significantly increase our chances of achieving just that. Thank you for taking the time to watch this important video today. I sincerely hope that the information we've shared has been helpful, informative, and empowering for you. Please consider sharing this video with your family members and friends, as it contains valuable information that could potentially benefit them as well. What are your thoughts and experiences related to this topic? Have you or someone you know ever experienced any of these signs? Please feel free to share your insights and experiences in the comments section below. Your contributions could provide valuable support and information for others who are watching. If you found this video to be informative and helpful, please give it a thumbs up to let us know. And if you would like to see more videos like this on topics related to senior health, well-being, and proactive health management, please consider subscribing to our channel. We are committed to providing you with reliable, easy-to-understand information and ongoing support as you navigate the rewarding journey of your golden years. Remember, you are strong, you are resilient, and you absolutely deserve to live your healthiest and happiest life at every age. Please take good care of yourselves, listen attentively to the messages your body is sending you, and never hesitate to seek professional medical advice when you have any health concerns. Wishing you all the very best in health and well-being. We look forward to connecting with you in our next video.